Let's talk about ST elevation. Welcome to Waveform Warriors episode 4. Heart is supplied by the coronary arteries, left anterior descending, left circumflex, and the right coronary arteries. To make it simple, left anterior descending supplies the anterior wall of the heart, the left circumflex supplies the lateral wall of the heart, and the right coronary artery supplies the inferior and posterior wall of the heart. And they correspond with the ECG leads shown here. So any block in these arteries will show changes in the corresponding leads. And to diagnose ST elevation myocardial infarction, we need changes in at least two consecutive leads corresponding to the artery. Now, these are the waves in a normal ECG recording, and these are their corresponding segments named based upon the waves they fall between. So, the ST segment, which falls between the S wave and the T wave, or the R wave and the T wave, based upon if the S wave is present or not. The beginning point of the ST segment is known as the J point. Normally, the J point lies near the baseline from where all the waves are recorded up or down. But if this J point is elevated above the baseline, at least 1 millimeter in any leads except V2 and V3. In V2 and V3, it depends based upon the sex and the age, which is shown here. Suspect there is an ST elevation MI. Also, there are reciprocal changes, which means ST segment depression in the opposite leads. Like if ST segment elevation is there in the anterior leads, either lateral or inferior leads should have ST segment depression. Now, we need two out of the three things to diagnose ST elevation MI. Either symptoms, ECG findings, cardiac biomarker elevation or falling trend, or echocardiographic findings. If any of these two things are present, we can diagnose as ST segment elevation MI. Now let's have a look at an example. In this ECG, there is ST segment elevation in lead V1 of more than 1 millimeter and ST segment elevation of more than 2 millimeters in lead V2, V3, V4 and V5, also in V6. And there is a slight ST depression in the lead AVL. So it is fitting all of our ECG criteria. Although the reciprocal changes are not that clear, but it is fitting the ST elevation criteria and we should suspect an ST elevation MI if the patient has symptoms or elevated cardiac markers or there are wall motion abnormalities on the echocardiograph. Follow for more videos like this.